In my HIV clinic in El Paso, most of my patient visits start something like this. Hola, mi nombre es Rafael Sánchez y soy su farmacoterapista. Hoy hablaremos de sus condiciones de salud, en particular la diabetes y el virus. ¿Qué me cuenta de su entendimiento de sus condiciones? And almost every time, I meet someone who's never really been told what's happening inside their body, how their medications work, or what questions they should be asking. For patients like these, patients who look like my family, speak my language, and trust me to guide them, these conversations aren't just about translating medical terms. They're about understanding their fears, respecting their experiences, and making sure they have the right care plan, clinically and culturally. I'm Rafael Sánchez, a clinical assistant professor and ambulatory care pharmacotherapist. But more than anything, I'm a pharmacist who believes that every patient deserves a pharmacist who's fully prepared to care for them, clinically, culturally, and compassionately. That's why I pursued BPS Board Certification, not just for the credential, but because my patients deserve a pharmacist who is ready for those critical conversations. And no matter where you end up practicing, community pharmacy, hospital, or a clinic like mine, your patients deserve that too. That belief that our knowledge is just as important as our compassion came from many experiences. But one incredible mentor showed me what it really looked like in practice. Her name was Dr. Julia Nickerson-Troy, and she didn't just shape how I practice, she shaped how I see myself as a pharmacist. During my API rotation, Dr. Nickerson-Troy paired me with a PGY2 ambulatory care pharmacy resident, someone walking the exact path I hope to follow one day. That layered learning model was powerful, because for the first time, I didn't just see the career I wanted, I saw myself in it. After pharmacy school, I completed 2 years of residency training, starting with a PGY1 in a resource-limited community health center, where I had to learn how to adapt clinical care to fit patients' real lives. My PGY2 in ambulatory care at the University of Florida gave me a different perspective, working alongside specialists and seeing firsthand how health disparities can exist right next to centers of excellence. I chose that path because I wanted to teach future pharmacists and stay grounded in real-world clinical practice, the perfect blend of academia and ambulatory care. That's when BPS became the next logical step. It wasn't just a credential, it was my way of staying engaged, credible, and accountable to my patients and my profession. When I think about the impact of BPS certification, it really comes down to 3 key groups. And I want to walk you through them because I think they matter to all of you, no matter where you are in your own pharmacy journey. Number 1, your institution and leadership, the people who make hiring and promotion decisions. Certification provides immediate credibility and signals that you bring advanced, specialized expertise to your practice. Number 2, your peers and future students, the pharmacists you'll work alongside and mentor. Certification isn't just personal, it's a visible commitment to lifelong learning, and it shows others that you take clinical excellence seriously. Number 3, your patients, the people who rely on you to make the right decisions, even when no one's watching. Whether they realize you're certified or not, they benefit every day from the confidence, clarity, and clinical reasoning that certification helps you build. There are more than 6,360 BPS board-certified ambulatory care pharmacists today. I'm proud to be one of them. But that number only matters if we commit to growing it, especially with pharmacists who bring diverse backgrounds, languages, and life experiences into patient care. For those of you in pharmacy school now, or just starting residency, here's my advice. Don't wait until you feel ready to start thinking about board certification, because none of us ever feel 100% ready. Start small. Learn what specialties exist. Ask your preceptors if they're certified and how they decided to pursue it. Reach out to a pharmacist you admire who's board certified. You'd be surprised how many are happy to share their story. Board certification doesn't just validate what you know. It helps open doors, whether you want to teach, practice, or lead. The best careers don't happen by accident. They happen when you start investing in yourself, even before you know exactly where you'll land. I'm Rafael Sánchez. Soy farmacoterapista, pharmacist, educator, and proud BPS ambassador. And I hope my story not only helps you see your own path, but inspires you to take the first step toward your own certification journey, wherever your career takes you. Because lifelong learning isn't optional, it's our responsibility as professionals. Our patients deserve pharmacists who are clinically competent, culturally responsive, and always striving to advance the standard of care for every patient, in every setting, every day.